This is One-on-One. Hi, I'm Steve Adubato, and we are coming to you from a studio you may not recognize. This is the Rutgers University ITV studio in Piscataway, New Jersey, and I'm pleased to be joined by Patricia Costante, who is the Chairman and Chief Executive Officer of MDAdvantage. Good to see you, Patricia.
And nice to be here, Steve.
I'm glad to catch up with you here at Rutgers. Let's talk about national health care reform. We're doing this program right before the presidential election of 2012. We don't know who was going to win that election, but the status quo is not an option with health care reform, right?
Right. I think as we look at healthcare, the major issue is really economics. It's not an issue of who wins the election, but can we afford the healthcare system that we currently have in place? And what kind of changes do we need to make so that it is more manageable from a national perspective and more manageable from the perspective of the physicians who are working within the system and people like you and I who have to buy healthcare coverage?
Now, Patricia, MDAdvantage represents physicians in terms of medical malpractice. So the question is, what would national health care reform mean to physicians, number one, and number two, to the physician-patient relationship?
I think right now what most physicians are struggling with is, as they think about national health reform, what they think about is reduced reimbursement to their practices. There's no other way to say it. They're going to be paid less for what they do. So they need to begin to think about how to build sustainable practices. And they're looking at that from a variety of ways. Can they become more efficient with more technology? Can they merge into larger groups? Do they need to become employees of larger systems? Those are all the changes they're dealing with, and each one of those changes has ramifications for the patients they take care of. One of the things I worry about is physicians telling me, I'm learning how to use the electronic health record. I have no choice. I'm learning how to use it, but what it means is that when you are the patient in my office, I really can't make eye contact with you because I'm filling in the data fields.
Excuse me, it's that, people talk about national health care reform and it's very esoteric. Now you're getting very granular. It's the actual process of inputting this electronic information. I can't look at you while I'm doing that, but I want you to look at me.
Right, and because there isn't enough advance in things like voice recognition systems, a lot of physicians feel they can't have the patient interaction and then deal with the medical record system because they need to keep moving to see enough patients to have a sustainable practice.
Sorry for interrupting, Patricia. Do you think the government, federal government, recognizes this as an issue for physicians, but more importantly, for physician-patient communication?
My sense is it's viewed as a learning curve, and while that may be true, the learning curve is a steep one, especially for mid-career or older physicians, and it has a very real impact on things like their liability exposure. If I have an interaction with you and never feel like I've made a connection with you, it's an awful lot easier for me to find fault with my care and sue, as opposed to someone who I feel like I have a very meaningful and close relationship with. And I know you did the best you could for me because I felt it in every instance that I met with you. It changes the dynamics drastically. At the same time, and I can't comment on the science, but at the same time, there are so many changes in the recommendations that are being made. PSAs probably no longer necessary. Those wellness visits that women needed to have done every year, you probably don't need that mammogram, you might not need that pap smear. It puts a physician in a position of counteracting everything a patient has believed and leaves us feeling, are you telling me that because it's true, or are you telling me that because it's expensive?
Hold on. Is the economic part of this part of the national health care reform that says keep your costs down?
I think that as a country, we're looking at keeping costs down. And as a result, guidelines are changing. As a patient, it's very hard for me to discern what changes are driven by economic realities and what changes are being driven by best practice in medicine. And I think for that patient who doesn't have this year's mammogram and then winds up with a breast cancer, it's very hard to say it wasn't economically driven. And that damages not only that particular patient-physician relationship, but I think it changes the way we view the entire healthcare system. And you can see that in countries that have national health services. Patients are much more mistrustful of the care they get, and in many cases, either buy up to levels of insurance, concierge levels of insurance if they can afford it. And if they can afford it, they leave the country for other levels of care. And I think those are all the things we will be struggling with as we move forward. We need changes. I'm not sure the changes that are coming down the pike are the best ones in the short run.
I need to ask you this in the limited time we have left, Patricia. The physicians that you deal with, that you represent, what advice do you give them right now, given the fact that these changes, they're happening, okay? What advice do you give them? And in turn, what advice do they give their patients, given the fact that these overwhelming changes are taking place?
Among the things we do is we try to work very hard to help them manage their practices in the smartest, most efficient way they can. Most of the physicians we deal with are coming to us saying, I don't want to be an employee. I want to be able to have a self-sustaining practice that I own. How can you help me do that? And so we work with them to bring in the practice management efficiencies that help them along those lines. The second perspective is we ask them to be very conscious of what is the standard of care in your community. There may be a new national study that's changing guidelines, but is that the standard of care in your community? Pay attention to that, because that's what a jury will pay attention to if you wind up with a malpractice claim. It's a difficult time to be a physician.
And finally, for their patients. It's funny because you were just talking about how to protect themselves as physicians, but finally, for their patients.
What they need to be able to do for their patients is step back and practice the best medicine they know how to practice. And I worry about the fact that the business aspects of providing care sometimes take time away from the clinical aspects of providing care. And that's where we really need to encourage our physicians to keep their focus. Have someone else manage the business of your practice. Pay attention to patient care. Only you can do that.
Tricia, let's agree to this, that this is an evolving process. There are no surefire answers. There are lots of questions. And you'll join us again and continue to give us this important perspective, particularly on the doctor-patient relationship, okay?
Absolutely. Thank you, Steve.
Patricia Costante from MDAdvantage, thank you very much.
Thank you.
Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. This special edition of One-on-One with Steve Adubato is brought to you from the Tisch WNET studios at Lincoln Center. Funding has been provided by Hackensack University Medical Center, Berkeley College, TD Bank, Qualcare Inc., a local managed care company covering 750,000 New Jersey residents, the law firm of Gibbons PC, and by Verizon Communications. Promotional support provided by the Star Ledger and NJ.com, Everything Jersey, and by the New Jersey Business and Industry Association and its monthly magazine, New Jersey Business. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.